Around the World with MS World, I'm Dr. Daniel Kantor, President of Florida Society of Neurology and Medical Director of Neurologique, an organization dedicated to patient care, research, and education. Professor Gavin Giovannoni from Barts in London School of Medicine and Dentistry presented information on the SELECTION trial. SELECTION trial is the second year of the SELECT trial, which is a trial of Daclizumab. Daclizumab, remember, is a monoclonal antibody, hence MAB at the end. Now, monoclonal antibody means mono is one, clonal means they're all the same, and antibody is one thing that sticks to another. So in this case, this investigational product called Daclizumab sticks to the interleukin-2 receptors. Now, interleukin-2 receptors and interleukin-2 we know are important in multiple sclerosis from some genetic studies. So it's actually interesting because it's a medication that makes sense from some of what we understand about the genetics of MS as well. And what it does is has immunomodulatory effects. And by giving this medication as an injection under the skin every 4 weeks, patients in the trial were able to have a benefit in terms of their relapses, their MRI, as well as their disability. The SELECTION trial has an interesting design because what happened in the first year of the SELECT trial, you had patients on placebo, you had patients on Daclizumab 150 and Daclizumab 300 every 4 weeks. In the SELECTION trial, the patients who were on placebo, who were nothing for the first year, they then got randomized to either receive Daclizumab 150 every 4 weeks or Daclizumab 300 every 4 weeks. But then they did something interesting for the patients who had been treated with Daclizumab, either the 150 or the 300 for the first year, and they did a 6-month washout to see what would happen if you take somebody off the medicine. Would you have that rebound effect that we think we see with IV natalizumab or IV Tysabri, the only monoclonal antibody that is currently approved for multiple sclerosis? And so in this interesting study design, they found a number of interesting things. One is that there was a 59% reduction in terms of the annualized relapse rate when people went from being on placebo for the first year to being treated in the second year. And there was a 54% reduction in terms of confirmed progression of disability. These are exciting results. Also, what happened in terms of the washout was that while people had more activity once they were no longer on the treatment, it didn't go over the amount that they had previously, which makes us hopeful that we're not seeing a large rebound effect where it would be very dangerous for somebody to transition from one medicine to another if they need to in the future. Now, Daclizumab can have an effect on liver, can have an effect on infections, can have an effect in terms of cutaneous or skin reactions as well. And as we learn more about this medication, we're going to see how it's really going to fit into our armamentarium. How is it going to fit into our war chest when it comes to multiple sclerosis? So as we see more of these results, it's going to help us to understand the future as this medicine comes to light and hopefully will eventually be available for people with multiple sclerosis. I want to thank Professor Giovannoni for presenting the data so clearly and concisely to the European Neurological Society and for making his slides available so that I could make them available to you back home. I want you to take care and I want you to continue to join us. Thank you.